Have you ever felt like your deep pelvic pain is being dismissed or just not understood? Well, this explainer is for you. We're going to break down a really crucial guide from Dr. Farzana Khan and the Women's Health Clinic that's all about how to advocate for yourself and finally get the answers you deserve. Okay, let's start with what is probably the single most important message in this entire guide. If you are experiencing pain during deep penetration, you need to know this. Your experience is valid. It is real, and it absolutely deserves a thorough medical investigation. It is never, ever just in your head. So, to make sure we're all on the same page, what exactly are we talking about here? This isn't a superficial issue. We're zeroing in on deep dyspareunia. That's a pain that feels like it's coming from way inside your pelvis, maybe involving your cervix, uterus, or ovaries. It can feel like an ache, a cramp, or even a sharp stab. So how are we going to get you from just understanding the problem to knowing exactly what to do about it? Here's our roadmap for today. We'll look at why this pain is so often ignored, introduce our expert guide, Dr. Khan, walk through the standard diagnostic process, and then, this is the best part, equip you with a self-advocacy toolkit before laying out your next steps. All right, let's dive in. So why is this conversation so incredibly important? Well, because for way too many women, getting answers about this kind of pain is a frustratingly long and often lonely journey. 7 to 8 years. Just let that sink in for a second. In the UK, that is the average amount of time it takes to get a diagnosis for endometriosis, which is one of the main causes of deep pelvic pain. That's almost a decade of pain, of uncertainty, of not knowing what's going on. And part of the reason for that huge delay is that there are just so many potential causes. It could be endometriosis, adenomyosis, cysts, fibroids, the list goes on. And that's exactly why a really systematic, smart approach is absolutely crucial to figure out what's really happening. So, where is all this amazing information coming from? Who is our guide on this journey? Well, let's meet the expert whose experience and insights are really the foundation of this whole explainer, Dr. Farzana Khan. With over 20 years of medical experience, from getting her degree way back in 2003 to all her work in obstetrics and gynecology, Dr. Khan has truly dedicated her entire career to women's health. This incredible depth of expertise makes her a guide you can absolutely trust on this kind of complex topic. Okay, so if you want to advocate for yourself effectively, you first got to understand the system you're working within. So let's take a look at the standard sort of textbook approach to investigating this type of pain. Typically, the journey follows 3 main steps. It usually starts with a Transvaginal Ultrasound, or TVUS. From there, it might move to a pelvic MRI if more detail is needed. And finally, you have the Diagnostic Laparoscopy, that's keyhole surgery, which is really considered the gold standard for getting a definitive diagnosis for conditions like endometriosis. But here's the question that so many of you have probably faced. What happens when you're in real pain, you go through the tests, and your scans come back normal? It feels like a dead end, right? It can be so disheartening. But according to Dr. Khan, this is not the end of the story. Now we get to the really good stuff. This is the practical, kind of insider information. Think of this as your self-advocacy toolkit. These are the keys to breaking through that normal scan dead end and pushing for a real diagnosis. Okay, first huge myth we need to bust. Not all scans are created equal. You hear your ultrasound is normal, and it's so easy to think, okay, I guess I'm fine. But the reality is, a standard run-of-the-mill scan can easily miss things like deep infiltrating endometriosis or adhesions. That's why you often need a specialist, an expert, performing that scan. And here's a very specific technique you can and should ask about. It's called the sliding sign. It's basically a dynamic test during the ultrasound where they check to see if your organs are sliding freely past each other. If they're not, if you get a negative sliding sign, it's a huge clue that adhesions or endometriosis might have basically glued things together. It's a powerful tool that's often overlooked. Now, what if your pain is less of a sharp stab and more of a heavy, deep ache that gets worse after you've been standing for a while? Well, the cause might be something called pelvic congestion syndrome. And in that case, Dr. Khan recommends asking for a very specific Doppler ultrasound to check for things like dilated veins and backward blood flow. You know, this is so important. It's not just about the tests you get, it's about who you see.
A general gynecologist is absolutely fine for an initial look, but if deep endometriosis is suspected, or if you have that negative sliding sign, UK guidelines recommend a referral to a specialist BSGE accredited center. These are the places with surgeons who are trained to handle these really complex cases.
Okay, I know that was a lot of detailed information. So now let's pull it all together into a clear, simple, actionable plan that you can literally take with you to your next doctor's appointment. Here it is, your action plan, straight from Dr. Khan's guide. Number 1, keep a detailed pain diary, track everything. 2, ask specifically for a specialist transvaginal ultrasound. 3, mention the sliding sign to the person doing your scan. And 4, talk to your doctor about whether a referral to a specialist center is the right next step for you. This is how you go from being a patient to being an advocate for your own health. So we'll leave you with this final thought. Getting a diagnosis for deep pelvic pain can feel like a marathon. But now, armed with these insights from Dr.